Ladies and gentlemen, boys and girls, young and the old, whatever, all that, welcome back. It's been a minute, it's been a second, but guess what? Girls Lounge is back. And today, as you can see, we are not alone. We have an amazing, handsome man here. Let me not go overboard. Let me shush. That's enough. So we have an amazing gentleman here, very handsome. Yeah, very ready, ready for everything. So, guys, put your hands together and your feet and your mind and your eyes and your whole body and everything together for
Eugene. My name is Eugene. Why are you looking at me like that? What do you want? What are you eager to hear?
I want nothing. Carry on.
My name is Eugene. Professionally, I'm a nurse. To be specific, I work in maternity. Outside the profession, co-curriculum activities are like I'm an entrepreneur, business guy. I love doing business. I do anything, literally. Except
as
killing
long
people.
As money is
so
involved.
long as money is involved,
your game.
me up.
Okay. Wow, quite an intro yo. Kama wengine Dion unajiintroduce ngajam Dion nini uko na kitu kimoja unafanya kwa hii maisha ndio done.
No.
Ndio. Usikie vile watu wako na 20 things they are doing out here,
Even me, anything that involves money, I'm game.
You're in.
I'm game.
Okay, anyway, and I am your girl, Vero Mukera, and of course with my amazing, beautiful, super co-host,
Dion Warwick Justice.
Yep.
So, without any further ado, let's go to the business of the day. Who is a midwife? Who is a midwifery? Nimetamka correct?
Yes.
Like, what is the role? Like, that is what, because from the word midwife or midwifery, to my own understanding, it's a woman's job.
Yes.
Because it's rare.
Mid-husband. So supposed to midwife, mid-husband. Like,
why?
You get where we're coming from.
Yes, I understand.
Yeah, like, what is the role of a midwife? Like,
so
midwifery.
Like,
yes.
Make it make sense to us.
Like,
okay.
What is the role? What are the challenges?
Let me bring you to speed.
Okay.
So, in the ancient times, when the so-called nursing started, it started with a lady who was called Nightingale. Nightingale was a lady who used to nurse the wounded soldiers in the World War I. I think 1 or 2, somewhere. I can't remember the exact war. So that's how nursing started. When she discovered that there are essential things to wound healing. So from there, nursing was then taken as a thing for the ladies. But with time and with the advancement of technology and knowledge around, nursing became a profession and not let's say not something done by a specific gender. So midwifery also same as midwifery. We had people who are called birth attendants.
Who are those?
Birth attendants were the traditional guys who used to deliver mothers.
Wakunga.
The ladies. Wakunga, yes, that is the Swahili word. So there were specific ladies in the village who were called birth attendants, traditional birth attendants. So normally in every community they had a lady because they knew that a man cannot look at a lady
down
during delivery. So that is how midwifery came about. So it came about from that traditional lady who used to attend. But with the advancement again, it became a profession. So the profession now involves both genders. But the name remains to sound like feminine.
But like the name remained as it had started. Like the name didn't change.
But now it is a profession. Then it was a skill, but now it is a profession where you go study about it and get the skills and the knowledge, as compared to what they used to do. They used to do it from the skills and overtime practices.
So, okay, now it's midwifery, right?
Yes.
So, like right now, you can literally do what the midwife does.
Yes, I'm professionally a midwife.
You are a midwife.
I'm already qualified. I can do anything pertaining a lady, from the way conception of the baby to birth of the baby.
Also, like
and beyond.
I can come to you for clinics. Like, you know, seem to after conception, someone starts going for clinic. Like, you understand all that.
Yes.
You can do that.
So, okay, what are the challenges that you face in there? Because
As a man,
most of the time, when you go there, okay, these are the stories that I get to hear. Like, our fellow women, they're not
kind or that,
or showing like concern, like
being gentle, being gentle.
mtu anaweza kuambia, like there's a friend of mine aliambiwa siulisikia utamu, you know, like
wacha kusumbua or something like
the opposite gender. Najuanga inakuanga huruma. So sometimes hata unaweza mhurumia uone tu anateseka useme
like you just be kind and gentle to them.
Yeah, okay. That is the perception outside there. They believe that when you are delivered by a man, it's better than a lady. But currently, we are working towards what you call respective mother care. You respect the mother who is pregnant, and this is how we are trained how to treat them. So such things are not supposed to be happening. And again, ladies, you understand yourself. Sometimes you have mood swings due to hormonal challenges. Let me say challenges. And you always act according to your emotions. So sometimes it's possible that there's a lady who maybe had some issues back at home or somewhere, and she will. Ladies do not know how to separate feelings and emotions from work. They always carry them to work. So it's there. It's also a challenge, but it's being addressed. But as for a man, I don't know, maybe a man keeps it professional because we can separate our emotions from work. A man knows what he's supposed to do and he will do that. Without forgetting, there are also ladies who are very good at it. They are better than other men. So we don't close that gap. So it depends on individual and how an individual handles.
Or maybe it depends. Kwa maternity who you find.
So there. Like, do you get it more often that, you know, mothers will prefer you to a lady if you're with a colleague lady?
Yeah, I get it.
So like it's
normal.
It's normal.
Yes.
Wait, so for
ladies believe like huyo ni daktari. You know, there is that kasumba like any man who is in the medical field is a doctor. And ni daktari. So they tend to think like this one is more qualified than the other, which is also a wrong perception. So not all male are doctors, and not all females are nurses or sisters, they call it.
Just out of curiosity, for how long have you been in this space?
In the maternity? Close to between 7 to 10 years.
Oh wow, my God. This is
whoa.
When I'm baby.
No.
On a light note. Because oh my God. 7.
Let me say. When we are in 2024.
Yeah.
Those the 2 years were not okay. If I use the 7 one, 2 years were not professional. I was a student then. Actually, the first baby I delivered could be around 10 or 11 years. The very first.
And you are a student.
Yes, I was a student then.
But like, do you remember the experience?
No, I don't think. I saw it as normal. You know. Okay, for me, in the medical field, I got exposed to the medical field at an earlier age.
Oh,
because
really?
of my parents.
Okay.
Yes, so my parents used to expose me to these things because they were also in the medical field. So I was never shocked about anything. because there's this condition of we call it PPH, postpartum hemorrhage. It happened to my cousin, and she was living then with us. So I saw her being managed in our own house.
Oh,
That
at
was
what
back
age?
in 2002, I guess.
Let me just
Jamani, you know, some of us tulikuwa tunatembea labda wakati. You know.
So
It's normal. But I look young.
there's a lot of questions.
No, that's a lie. You're old.
There's a lot of questions that I usually ask myself because recently we've been having cases of mothers dying at childbirth. Then there's always this notion that, like the traditional way, maybe you guys shared somebody somewhere, now she came or he came.
I know.
You see, now I just sometimes I fail to understand because
Is it true?
if I reason that way, it might be wrong of me. And again, if you look at it in a medical way, maybe it was a medical mistake or something like that. But people think that like, is it true? Like it's natural,
such a thing can happen.
Such a thing can happen, or
It's just myths and misconceptions, you know, that are from Kitambo and people are still.
From the medical part of it,
what can cause for a mother to die while giving birth?
there are so many things that can cause a mother to die while giving birth.
And
but the higher percentage is that PPH, postpartum hemorrhage. PPH is a wider field also, which but we are giving the knowledge out. I'm one of the mentors of this obstetric emergencies in Kisii County. So we are trying to disperse this information to even the periphery areas so that such things will not happen. But again, like we said, in this life we have these different aspects. There's the spiritual part, there's the scientific part, and everything. So for me, I wouldn't, from scientific part, I can't prove whatever she's saying. That thing called like amasangi. People believe it happens. For me, I don't believe it happens. But there is a time, a few instances. Actually, last night I was on night duty and we had that conversation with my colleagues. And one came out. The conversation was between us also and the patients. And one of the patients gave a testimony that it happened to her friend. So we also don't assume that aspect. Because when the point of need comes and when they do their thing and it works and it helps a mother, at the end of the day we are working towards safe delivery and we are working towards a mother going with a baby and happy home. So there's also that aspect which, okay, scientifically it's not logic, but it happens. Yes.
Well, so I don't know. Personally, I don't subscribe to it, but of course, like you said, there's that, like, you know what people say, like you just don't assume it, you know, you just have it at the back of your mind, like, you know, there's this thing, as much as you don't subscribe to it. So I don't know, like, what is like a normal day at work for you? How does a normal day at work for you look like?
I don't know what can I talk about that. Just a normal day, like you going to work, you maybe once we go to the duty, maybe I'll report at as early as 7:30. We'll be given a report. A report includes what has happened throughout the night, the number of patients, any pending issues. Then you begin from there. After you've gotten the report, then you get to work. You get to do examination of each and every patient.
Like
sometimes when you go to work, do you have some maybe fear or something? Maybe, you know, I'm going to do this, like I just hope everything goes well. Do you have that fear?
No, I think with the experience and everything, I don't think there's something that I can't face.
But you used to.
There's a time you would fear when maybe you look at the duty, you find like you are alone. back then when there's shortage. You know, when you find like, I don't have the support, enough support, the fear will come in. But then with time, when you get to experience and you've gone through all these conditions and you have the knowledge and the skills, I don't think there's that fear. But of course, when we are prepared for any case, but when it sets in, there's that fear, and but there's how we can overcome it. Once you have your team around, we have what we call emergency team. So in the emergency team, you have someone who is controlling everything. That is the commands, the person who is commanding. So if you have that guy and he's well skilled, you will always pull out everything. But again, there is that aspect of God when everything is beyond us. There's a point where we can't do anything.
Have you ever lost a patient? You like while you're the one on duty, you're the one attending to her.
Yeah, we have lost patients.
How do you feel like you failed?
Yeah,
do you feel like you failed or something?
Failed. Maybe you failed. Maybe
or even
the mother
not only the patient, or even the kid, dies, and then the mother.
You feel like you failed one of them.
Of course, that aspect is there. You will always ask yourself a lot of questions. What if I didn't do this? That one is always there. The blame game. There is a time you will blame yourself. But now, the problem in Kenya now, we don't have the. You always assume that a person working in an hospital is always okay, which is wrong. Actually, when you lose a baby in some setups, in some other hospitals, when you lose a baby or lose a mother and you are the one who was dealing with that mother directly, you will go through some psychological classes and any. But then in our setup, the African
just
setup,
continue.
they assume
it's
normal.
Yeah,
but it's not normal.
Yeah.
There's a time when you will bond with a patient and you get close with the patient, and it reaches a point where you lose this patient, not because you did not do it, you did everything possible you thought of, but the patient still
did not make it.
So you remain with a scar, and that one will even disturb you up to 3 months.
Because
you remember, you will feel, you will hear the voices as she was talking, maybe calling for help. So sometimes it traumatizes us, but we always look for the Most High.
Man, I don't know.
Me, honestly, I just feel it so
or it's like, you see how we, like in medical school, like are you people like, I don't know, does med school make you to be somehow numb to pain or something? Or like pain, like a patient is suffering here and you're used to seeing that,
The worst patient you can ever meet in our field is a medic. That is the worst patient you can meet.
Oh, really?
Yes.
How?
Medical personnel fear pain. Because already they know. If today I felt pain on my knee, there are a lot of things that will come to my mind. I'll think of arthritis, I'll think of losing this knee, I'll think of everything, the worst. You see? So that is the worst patient you can ever meet in the medical field, because you already have the knowledge and you know what the prognosis can be. So the training actually does not help you to overcome the pain. It actually makes you fear more, because you already know what is
prompt to happen.
Cause no,
if today, like a few months ago, I had pain on my shoulder. Actually, this side of the shoulder. I thought of how I've lost my arm. That was the first thing.
Like the first thing you think
myself
of.
Without a hand.
Oh my God, it's crazy.
Yes. So sometimes it does not help. It instills fear, but at the back of your mind. Once it happens to you, that is when the fear comes on board.
Like, is it that is when it's you, like when it's somebody else, or when you're in the hospital,
you
set up?
No, when it's somebody else, mkuki kwa nguruwe.
Oh really? Because I asked that because
there is no pain, but actually you are supposed to treat that patient with empathy, and all those aspects of caring nini, but
But you're not supposed to put your feelings there or emotions.
if a child comes here, the child is sick, I'm supposed to cannulating is mnaitanga kuweka line. Yes, kuweka hiyo line. This kid will be crying all the time, but we need this line. Would you stop putting the cannula because the kid is crying, or you'll proceed and get the cannula so that the baby gets better?
Well,
See, so if I was emotional, or if you find one of my colleagues is emotional and starts crying because the baby is crying, the baby will not be helped. Sometimes you have to be hard on patient. A patient comes with a wound.
it's
Painful.
Yeah.
You're supposed to clean it. What do you do? You just talk to the patient, tell the patient it's going to be painful and this and this. Then you can give medication, but in some other setups, they sedate the patient or they numb the area, then do the cleaning. So it depends on your level of the hospital and skill.
So I'm curious. So this is one thing I've really wanted to know. What exactly happens until a mother gets a tear during delivery?
During delivery, one, skills of the midwife. Two, could be maternal issue. Maternal means or your skin, how much tension can it hold. Secondly, how many deliveries have you had?
Oh, that's a determinant.
Yes.
Okay.
First delivery, we expect a tear. We expect.
Well, it's not a must,
It's not
but
a
it's
must, but
expected.
we expected. So 4th, 5th, 7th, 10th, we don't expect. Actually.
Like your.
So if you have that tear for the first time, you're not going to have it.
Is
for
it
the second
guaranteed
time.
that
No,
you will have
you
it?
can always have it. Depends.
Whoa.
Kichwa ya mtoto si same in every deliveries.
So it also
Plus,
depends with the.
Every delivery is different from one mother, from one baby to another. So
Okay, and me, I want to ask. You see, nowadays we have a lot of cases of cysts, fibroids, and stuff. So you'll find like maybe you have that ovarian cyst. The only way out is through an operation.
Yes.
You get like it's almost the same as a C-section, right?
Yes.
Now, when you get pregnant, do the scar hurt? The same scar you had? Like, kuna mtu ashaniambia like the more the tummy grows, the more it will feel pain. And again, will you be able to deliver normally, or you'll go for a C-section?
Okay, for that one depends on the individual. Actually, you always treat a patient individually, not as a group. Not everyone will react the same.
Because people are different.
Yes. So again, secondly, when was the operation done? Was it was done in a short time and you are supposed to deliver? We can't subject you to pain because of course that the healing could be out here, but inside it has not healed. Depends on also the time you've taken after the operation. Again, the cyst also depends where was the cyst. Could be ovarian cyst, could be uterine. So it depends also the site of the cyst. If the cyst was actually if the uterus was touched, that will call for C-section. So it also depends. You can't treat all cases the same. If you had the cystectomy, you can also deliver normally. Depends. So it all depends with an individual.
So if I come to the hospital, like right now I'm pregnant, I'll choose which I can even choose for myself which way I want to go.
Yes, you have the right to choose how you want to deliver, and you plan with your doctor.
But when complications come in now, it's up to the doctor to decide.
When it comes to emergency,
yes,
you'll be it's not the doctor to decide. You'll be advised and you make the right choice. You always advise.
You'll be advised while in pain.
You have relatives, you have people around you,
but
you are not always in pain constantly.
She can't make the right.
Of course, you can judge when a patient is making a decision out of pain. Okay, but you will always give her information, give her time, so that the information sets in. Then you go back again the second time and the third time. Then she would make a right decision. Of course, the person making a decision must be having an ID. If the lady, we have teenage pregnancies. If the lady is underage, the relative will make the decision for.
Okay.
Yes.
Okay. And again, do I have to wait for? How can I put it? Do I have to wait to experience labor pains before I come to the hospital to deliver, or can I come earlier before the labor pains and just deliver just like that?
You can't deliver without pains.
Hey,
It's the pain that pushes the baby.
How does pain come? There's
Contractions
towards your.
like I know, like maybe we've sat with my doctor. We know I'm supposed to give birth between these dates.
Yes.
So mimi kama Dion, I'll choose. I don't want to start jumping and dancing Lingala. I just come on time.
But again, it depends on the mode of delivery. If it's a CS, you don't wait for the pain.
Okay.
You are given a date. Okay. If it's a normal delivery, we have to wait for onset of labor.
Where?
The onset of labor, how does it come? It comes with the maybe breakage of water, the pain, in the lower abdomen that radiates to the back. There will be maybe mucus, like the blood, something coming out of your vagina. That is what we call show. Could be there. Plus, there's also in the card, if you gave the dates well, it will tell you when you are due for delivery.
Okay.
So it all depends on how you.
Like, would you advocate for, like, there are no complications, I don't have any complications, but now would you advocate for me to go for normal delivery or CS delivery? I don't have any complication.
Normal delivery all the time.
Why?
I tend to believe normal delivery is the safest mode of delivery. If I don't have a complication, it is not a guaranteed 100% that you will go to theater and come out.
Yeah, true.
You can come out, maybe there was injury, maybe there could be complications post the surgery. So if I'm able to deliver normally and come out successful, why should I expose myself to other complications?
How can I know I can do that?
That is why you're supposed to visit a doctor during your NC visits.
So during that period,
clinics,
I can know if I'm going
they will
to
tell you. That's why we do examination. We can tell this one has enough pelvis, the pelvic size where baby can go through. We also look at a lot of things: height, weight. There are so many
during
things
that Nini, you can tell if a baby is going to be born differently, or by differently I mean
yes,
the
mode of delivery. Yes, because not all babies come with head. Some come with footling, that is a leg. Come with a hand.
That's normal.
That is normal. That is a complicated delivery.
Wow.
They could be twins. They could be one coming with the buttocks. So there are so many different. There are so many different ways a baby will come. We will present in the what we call birth canal. So the presenting part also matters.
Like,
so that's why you're supposed to go to the NC clinic until the last one, so that they can predict. You can always predict. You can't know, but you can always predict that this baby could come out or could not come out.
like can you be able to tell before a baby is delivered that maybe they are going to be disabled or
Okay,
not
I just
be
wanted
normal?
to ask that question.
Yes,
This
they are
way,
not
let me
going
put
to be
this
normal
way.
or something.
A lot of parents, when they give birth, they don't know if the kid is alright or not. And in some hospitals, like, is it are we supposed to get some pediatricians in the in the labor room or the
After
delivery
or post.
room, so that they can examine the baby if he's okay or if she's
Like if
okay,
a mother,
if she or he is autistic, has some complication, disabilities and stuff. Because I see a lot of them go home, like nowadays, autism. You really don't know the child. Mtoto anamea. Before you start noticing, it's too late.
Okay. After delivery, you can't tell immediately if the baby is going to be autistic or such conditions. Those things come during the developmental stages, how the baby behaves, how the baby presents. Okay, that is when you can tell if the baby is going to have an issue. Ideally, when a baby is delivered, let me say, for example, I had a privilege to work with the Karen Hospital, that one owned by Dr. Gikonyo. So in that hospital, a delivery is done, a normal delivery is done by a gynecologist. Then once the baby is out, the baby is handed over to a pediatrician. The pediatrician will do the first examination of the baby. But in the first examination of the baby, you can only tell any deformities of the baby, abnormality, which is obvious, like the head circumference. If the baby is having, let's say, a big head that is hydrocephalus, that is when you can tell, the obvious one. But when it comes to genetical, you can't tell until the baby gets to the developmental stages, where you can get the baby is going to be maybe slow in some stages, maybe walking, speech, grasping. That is when you can tell that this baby has an issue. As a mother or a parent, if you get these things, you're supposed to seek medical help. Almost, actually, if not immediately, almost immediately, so that you can help the baby adapt faster, because there are guys who are trained on how to deal with this.
and can, for instance, like autism, like if noticed earlier, can it be prevented?
Prevention. Autism you can't prevent.
You can't
It's
prevent.
already
You
in
can
the,
manage it.
It's like a system. It's already in the system.
Yeah, you
What-
just have
It's like
to
in the
manage
DNA
it.
or
Yeah.
something.
Yes, what you can only do is help this kid avoid the aggravating factors. There are foods that
They're not supposed to eat.
To
There's a certain way they're supposed to
live.
live.
so that they don't get to these episodes of there's how they
Autistic
behave.
episode.
Yes.
Yeah.
So there are some foods they are not supposed to take. There are some environments they are not supposed to be. Yes. The lighting of the house, Nini. So there are so many things that you'll be told about the baby. Yeah.
Oh, and after, for instance, if now the baby has to be delivered prematurely, like how long are they supposed to stay in the nursery before they now?
Again, it depends with the baby. There are some baby who catch up early. There are some baby who are slow. So it also depends with the baby, and also how the mother takes it. There's a mother who will get into depression. Oh, my baby got to nursery. That doesn't mean when a baby
Is nursery
goes,
a bad thing when the baby gets to nursery?
no,
Is
it's
it like
not
a
bad thing. It's not a bad thing.
Is it something that somebody is supposed to be scared of, or it's just normal?
like does it lower the chances of survival of the kid or something? Like is the baby at risk?
No. The baby is not at such a risk, as it's not like a big issue. So sometimes it's a baby has been born underweight. You can't take that baby to the house because there are some mothers or parents who misbehave. They will go and start feeding the baby with solid foods, which is not correct. So when the baby is there, the baby will be monitored in case of anything. It's easier, it's warmer there than home. Of course, there are machines that provide the heat there that is supposed to be given to the neonates.
Ni kama ako kwa tumbo.
Yes, same heat. So if you go home, you will not be able to provide that unless you have that machine, of which no one can afford that one at home, and you don't know also have that in mind that you will have
Stima
that machine.
zinaweza potea.
Stima inaweza potea, generator inakuanga hospitali throughout. That's why in Kisii County actually we only have a nursery. I think if not also Krista Maria, it's only in KTRH. I think so. There is one hospital that has that because it's expensive.
So if I deliver in a different hospital, the baby has to be taken to that hospital.
Yes, we come to KTRH for NBU services. Mostly around they come there. So the baby, once the baby goes there, doesn't mean that you will lose that kid. Yes, the baby, some babies lose life there, but it's too some we can't explain why. But a bigger percentage go home with their kids. Yes.
So not like they are such a big risk or something that a mom should be worried and stuff. And what
but it also depends how you are given information. The nurse who delivered you, or the person who was involved in delivery should explain to you why the reason why the baby is going there. One could be a big baby. A big baby means like 4 kgs and above. That baby could be normal, but is overweight. Once that baby is overweight, there is what we call diabetes. We do the sugars. Normally those kids, if you let them go home, the milk from the mother will not be sufficient to match up with the sugars of that baby. So the baby needs to go to nursery for monitoring, observation. So if it's just observation on how the sugars are behaving, does that mean that baby will not come out? Doesn't mean so. So sometimes baby kids go there for observation. Some go there because they are sick. So it all depends with individual babies.
and I mean what is the earliest that a kid can come, I mean, will
Like
have
I
to
said,
be taken out?
observation could be 24 hours. After 24 hours, you have your kid. After 48, you have a kid. If the baby is underweight, depends on how you, what we call your BD, yani your, what we call it in English. Your how motivated are you to take care of that kid? How you take the care of that kid? If you do the correct thing, the baby will gain weight much faster.
So, and this overweight kid is supposed to lose weight or something?
No, it's just sugars. If the sugars are normal throughout, you will go with your baby.
Okay.
Yes. So it bends with sugars. You know, the sugars could be shooting high and low.
So does that come about due to, I mean, the foods maybe mother was eating while pregnant or something, or the lifestyle the mom was having?
Yeah, it's maternal.
Oh, so like all these things are...
It's maternal. It all depends maternal. Maternal now means lifestyle, maybe that's food, or the mother could be diabetic. Yes. If the mother is diabetic,
so the kid might be born with diabetes.
Yes.
Oh, and I mean, how does I mean, this is something I've seen mostly common. How does blood pressure, or mothers with, or women with blood pressure, how does it, I mean, affect pregnancy? Because it's a thing I've seen quite a lot of times. How they struggle with pregnancy and how it's such a risk. And sometimes the baby might need to be taken out.
Even the mother might.
Yeah, for them to survive.
The body of a human, normal, if a mother is a normal mother, does not have a pregnancy, she's having pressure, okay? A high blood pressure, let's say so. So when she's having high blood pressure, means there's an issue with the heart, veins. There are so many the things that the mechanism that is involved with blood is compromised. So again, now she gets pregnant. That means there's an extra job for the heart.
For the heart and
one extra job for those veins and the arteries. So they need also to supply blood to an extra
Person.
Already she has a problem again. There's another human being also needs support from the compromised person. See, so now that one brings about the issue of pressure, that the fluctuation. The pressures go high, sometimes go low. So, but there are medications that are there to stabilize the.
At what point is the mom at risk that, mostly see, somebody will be like, my baby had to go. Like the doctors will advise, like, now we have to get rid of the baby for you to survive as a mother.
There's a point when the pressures get so high.
And they don't come down.
So high, they don't come down. The mother starts having seizures. Seizures are the
palpitations.
No, not passing out. Actually, is the in Kisi they call it kumagaka, or the shaking. That is another word I'm looking for. It's gone. So when the mother gets there, and there's how we classify. There's what we call eclampsia, preeclampsia, and eclampsia. That is the word for high blood pressure in a pregnant mother. So there's how we categorize them. So when it is very severe, that is in the eclamptic phase, there's those signs and symptoms the mother will present with. And if we try as much as we can to lower the pressure with medication and all the other skills that we have learned, and the pressure doesn't come out, now the baby has to come out. Now here you will choose between the baby and the mother. Do you want to have the baby without the mother, or the mother without the baby?
So you want to say, if we choose the baby, after delivery the mother will
die.
Yes.
That's automatic.
No, it's not automatic.
But
there are chances. Yes, the chances. Okay. When it gets there, the baby will get out. If the baby is okay, the baby will go to the nursery. Okay. Then we deal with the mother and stabilize the mother. There's a level. There's how we do it. It's a long process. I can't explain it in this episode. So there's how we classify those. Who is this baby to come out? If the baby needs to. But we try as much as to push delivery we push the pregnancy to term. But if it's not possible, again, the baby has to come out, because we need the mother more than the baby. Because you get a mother has like, let's say 4 kids. Then this mother dies. Who's going to take care of the other 4 kids? You see? So there are times when it comes, you must make a tough decision. Yes.
You've been in such a situation.
Severally.
So like
so
I even don't know what to say, because it's just crazy, and it's I don't know. I mean, this is why profession zingine, no. So like I don't know, let me just take you back, like so it's something like you really loved. Like, do you love being in this space, like having to deal with all this, having to like bring lives into this
something
world,
like you're passionate about?
Or again, you said your parents have the background of medicine and stuff. Is it that the reason as to why you got into the medical field?
Something funny.
Or what
in
made
our family
you?
Is only one person who is out of the medical field. Only my younger brother. My immediate sister is also a nurse. The one who follows me. Then my brother is in school. He's doing something. What do we call this computer thing?
IT.
No. Software engineering. It's also that field. I'm not sure. That is the only person. The rest of us were in the medical field. So
including your dad.
Let me say it is inborn, yes. It is inborn. And again, Mimi, there is that thing like, for me, let me say me personally, nursing is a profession. So I'll do it as a profession. The passion comes, but also the professional part. You ain't passionate about it? I'm very passionate, because, I've been to so many trainings about nursing. If I was to leave the nursing part, I would have left it in 2017. I would have pursued something different. But I'll be in the field. I'll be in the field. But who knows?
Are you going to encourage your kids to, as much as yes, it's up to them to make the choice and decision, but are you going to encourage them to coming from a background of your parents who are in the medical field?
No, I would like them to diversify, to go to other different fields because in the current situation in Kenya, the medical part actually is somehow frustrating because we are not given the much attention that is needed as medics. But if we were in other countries, you know, in like let me say in the UK, in the US, once you tell even any other person random that you are a nurse, they always know you are the high paying checks. They call them high checks, something like that. So
They're
in
the
other,
most paid people.
yes, in those countries. But when you come to Kenya here, in Africa actually,
Africa, yeah.
they don't pay according to your profession. They just give you peanuts. So in Africa, I prefer someone going into business than the employment part. Yes.
Oh. So like, do you have any regrets or something?
Regrets?
Yeah.
No, I don't regret.
With all those frustrations.
I don't regret because seeing a mother going home with a kid, very happy.
That's
I'm
like
okay.
the highlight of your day.
Yes, it's okay. I feel good. Okay, if I help a mother that was almost going and survives, do a follow-up maybe 3-4 days later.
Oh, you normally
she's
do
gone
follow-ups?
home. Of course.
Wait, maybe just
On a personal level,
as-
you have to do a follow-up.
as maybe we wind up and stuff like after delivering, or especially I'm not going to talk about a normal delivery, someone who had complications.
Yes.
And they've gone home, like is there a follow-up that is done as they're going home, or until later Mwatarudi?
No, we do a follow-up. If you are closer to that patient, you will even have the phone number. You would call and ask how. And some take your number actually. They always
So they can even
I
consult.
have a patient I handled back in Nairobi when I was working in Albland. Up to date, that is close to the last time we had a conversation was in 2018 on one-on-one. She's still there. Like a few weeks ago, she called and consulted me.
Or she's pregnant again?
No, she's not pregnant, but she was consulting something about I think a sister who was pregnant. So she still consults up to date.
How does that make you feel? I mean,
it means I did a good job.
Obviously.
So you feel good.
Obviously.
You feel good because she entrusted you and you gave the correct things. Actually, whenever the kid is sick, she will always call me. Even the slightest thing, she would call and ask me, what would I do before she goes to the next hospital. Yes.
So do you feel like mothers deserve like the respect that, you know what, child bringing a kid into this world, and childbearing is not an easy thing? As someone who is normally there and you've seen lives end during that, and you know, like, do you feel like it's honestly a matter of life and death bringing a kid into this world?
Back then it was a matter of life and death, but currently with the knowledge and the skills around, should not be a life and death. And that's why we also advise the mothers to go to clinics as early as possible so that you can detect any complication that will come about. It's good to go to a clinics. Usifike, you are 8 months pregnant and you've never stepped in a clinic. Now, how do you expect this medic to handle you? One, we need to know your blood group. We need to know blood group is very important because we have the DNA factor, the rhesus factor. We have the positive and the negative rhesus factor. It's very important for you and your kid. So if we talk about the rhesus factor, we talk the whole day. But it is important because if you are rhesus negative, is a drug that you're supposed to be given. Again, blood group is important because during delivery you must bleed. Must. So if you have low HB and you're losing blood, that is going to bring about a complication. You have to look at your HIV status. This is important to the kid. We look at what we call syphilis and all the other STIs.
Infections.
There are some diseases that cross
Might affect the baby.
the barrier.
Yes.
So we need such things early. We need to know the pressures and how you are doing, weight gain, weight loss. See, those are key things that will help the medic predict whether there is going to be a complication or not. So the earlier you go to the clinic, the better.
Or maybe you. Wow, I feel like this is such an extensive topic that, I feel like we still haven't tackled much. We still haven't done. I don't know, maybe we'll still have you some other time to again maybe talk about this, because I feel like it's so wide and hatuwezi maliza na just one episode or something, But generally, just something for our viewers as we wind up, generally from a midwife, from your profession point.
When you put it at general, in a big aspect. Okay.
You can even specify.
Okay, let me say, it's a beautiful thing to work in maternity. Okay, personally, I'm passionate about it. I'm not that, I don't think, I have knowledge, but I'm also getting more knowledge from other professions. We are advocating for safe motherhood, safe deliveries, and safe baby also. And we are always happy when a mother goes home with a kid smiling, a good, let me say, a healthy kid. So we also advise mothers to make it easier for the medics by attending these clinics. They are very important. I think I've repeated these things several times.
Yeah.
So it is very important because that one will help the medical personnel who will be on the ground to help you as you also get a safe delivery. I don't know what else to say, but I think we'll meet in the
Yeah, you
okay.
Those of you who are coming, we'll meet there.
Okay.
She wants to come soon, so you will meet
very
with
soon.
her.
Very soon I'm coming.
You're most welcome.
Yeah. So thank you so much for coming.
Yeah.
We are looking forward to having you back again.
Definitely.
We have a lot of things to talk about. Yeah. So thank you guys. I've been your host Dion alongside
Mokeira Veronica, and from us, Girls Lounge. Keep it locked.
so-
If you haven't subscribed, please subscribe to our YouTube channel and share, like, comment, because we are going to have amazing conversations here, including today's. So, bye-bye.
bye.